Hi, my name is Mariah Messimer, and I will be discussing the effects of music therapy on depression. Of the nearly 7 billion people in this world, there are approximately 350 million people that suffer from depression. Depression is the worldwide leading cause of disability and contributes majorly to the global burden of disease. One therapy whose impact on depression is still somewhat unclear is music therapy. In general, music therapy has been determined to be accepted by those who suffer from depression and has been associated with improvements in mood. Depression is a complex disease that is frequently misdiagnosed because symptoms of depression can be related to other conditions. Some symptoms of depression include feelings of sadness, despair, hopelessness, helplessness, chronic pain, worthlessness, and irritability. These symptoms could also be associated with PTSD, fibromyalgia, or anxiety disorder. Not only does depression bring about a variety of symptoms, but there are also a multitude of causes. Some of these include sexual and physical abuse, certain medications, death or a loss, major life events, substance abuse, serious illnesses, and a family history of depression. Those with depression have also been shown to have a smaller hippocampus, which results in fewer serotonin receptors, which is a neurotransmitter responsible for mood. The two most well-known and common forms of treatment are counseling and antidepressant medication. Counseling can involve cognitive behavioral therapy, interpersonal therapy, and problem-solving therapy. Some of the medications used as antidepressants include serotonin reuptake inhibitors and norepinephrine reuptake inhibitors. There are also some less common and more extreme treatments for depression, which include electroconvulsive therapy, transcranial magnetic stimulation, and vagus nerve stimulation. These treatments are expensive, risky, and can take several months to produce results. Despite the successful outcomes of these previously mentioned treatments, there is a fairly inexpensive form of therapy with no side effects. Although not completely evaluated as of yet, music therapy has been proven to have successful outcomes and with further research and evaluation will hopefully become more widely used. When used on mental health patients, negative symptoms were reduced, the ability to converse with others was increased, the tendency to socially isolate themselves was decreased, and their level of interest in external activities was increased. When music therapy was used on depressed adolescents, their cortisol levels were decreased, which is the hormone that causes stress. There are a variety of reasons as to why music therapy is proven to be successful. A majority of it has to do with how our brains are programmed. From the day we are born, our brains are wired to respond to music. When a person hears music, it is sent to the brain for processing via the auditory nerve, but some of it is processed by the motor nerves, which is why our bodies are naturally able to move along with the rhythm. Anytime someone is listening to music and they experience goosebumps, an increased heart rate, or quickened breathing, that is their brain responding physiologically to music. That is why music can be used for relaxation or stimulation purposes. Music is a useful mnemonic and can be used to make teaching concepts, ideas, and information easier as well. Music therapy can be utilized in a variety of ways, such as singing along to music, meditating along with music, playing instruments, writing songs, singing, painting while listening to music, and exercising along with music. The positive side effects of music therapy include reduced muscle tension, increased self-esteem, decreased anxiety and agitation, and increased motivation. Not only does music therapy provide behavioral benefits, but it also has been proven to save patients money in some cases. Music therapy has been used in some neonatal intensive care units, and because of the healing effects of music, some babies and their families were able to save $10,000 per visit. Many studies are being done and have been done to show the beneficial effects of music therapy. Researchers from the Northern Ireland Music Therapy Trust and Queen's University Belfast gathered and analyzed data on young individuals who had been receiving treatment for emotional, developmental, or behavioral problems. One group consisted of 128 participants who received traditional therapy, and the second group consisted of 123 participants who received music therapy along with traditional therapy. At the end of the study, it was found that those who received music therapy showed increased self-esteem and decreased symptoms of depression. Another research trial was carried out by researchers from Finland and Norway, and funding was provided by the New and Emergent Science and Technology Program. The study was composed of 79 participants aged between 18 and 50 who had been diagnosed with depression. Those who were already taking medication prior to the study were able to continue taking medication throughout the trial. The study consisted of two groups. One group received traditional care alone, and the other group received traditional care along with music therapy. The music therapy portion involved playing either a mallet instrument, a percussion instrument, or an acoustic djembe drum. Clinical measures of depression were measured at the beginning of the trial, the end of the 3-month trial, and 3 months after the trial ended, using the Montgomery-Åsberg Depression Rating Scale. After the 3-month trial, scores of depression symptoms improved by 4.65 more points on average with those who received music therapy. Those who received music therapy also had general functioning improvements by an average of 4.58 points. After follow-up was conducted 3 months after the trial, differences between the scores were no longer significant. The cancer that affects many women in today's world, breast cancer, has been shown to bring about depression in the women suffering, which in turn can affect the duration of the patient's hospital stay. A study that I found particularly interesting was conducted on 120 women diagnosed with breast cancer. 60 patients received music therapy along with standard nursing care, and the other 60 patients received standard nursing care alone. The scores were collected from a pre-test and 3 post-tests. The duration of the patient's hospital stays were based off of the first day after radical mastectomy to the day the patient was discharged from the hospital. After receiving music therapy, the depression scores of the post-test were significantly lower than those who did not receive music therapy. The hospital stay of those who received music therapy was also significantly shorter. As music therapy becomes more discovered, the future of the use of music therapy becomes more and more promising. As people are becoming more exposed to the fact that music can communicate in ways that language cannot, and music has the potential to heal the human body, it is predicted that music therapy will continue to gain in popularity and it will gain more exposure. The main barrier that music therapy faces at this point in time is that many insurance companies haven't begun to cover music therapy sessions as of yet. Despite this setback, it is still expected that music therapists will become seen more in society in facilities such as nursing homes, assisted living facilities, oncology centers, hospice homes, and even correctional centers.